Hospice and palliative care are very similar, but they are not the same things. Hospice can provide palliative care, but they both provide day-to-day care for the patients, bereavement, equipment, medication, and symptoms management treatment. The thing that makes them different is the timing, the location, the payment, and the eligibility for services. For hospice, is typically a at-home program, so the patient stays at their home, and they rely on family caregivers and the hospice nurses. Palliative care typically takes place in a nursing home, long-term care facility, or hospital setting. More often, it's the hospital. And they are cared for by a care team of doctors, nurses, and other medical trained professionals. The timing for hospice, the patient has to be terminally ill. They have to be referred to hospice by their doctors, and they have to be within 6 months of their death. However, palliative care, there's no time requirement, and the patient can be at any stage of their disease process or illness, and they can receive palliative care. Payment for hospice is typically all-inclusive, and insurance typically pays for it. However, if your insurance does not cover all your hospice can offer a subsidized payment plan or subsidized care plan, and this is just for the economically disadvantaged, and also Medicare covers a lot of hospice for the patient. Palliative care is billed to your regular medical insurance. It's billed individually. All the treatment you receive is individually billed to them, and it will only, for like medications, it will only cover medications that is covered by the patient's insurance plan. Hospice and palliative care's main focus is to make sure the patient is comfortable. Where they differ is hospice is they will forego any life-prolonging treatment, so the patient can just focus on the rest of their life that they have to live and deal with the emotional and practical aspects of dying. Palliative care, the patient can receive life-prolonging treatment. And this because they don't have to be terminal, and they can receive it at any time. A local hospice that's around here, if you need one, is Alive Hospice. It's located at 1718 Patterson Street, Nashville, Tennessee, 37203. The phone number is 615-346-8320. And their email is info@alivehospice.org. For palliative care treatment, you can go to Vanderbilt Palliative Care, and that's located at Vanderbilt University Medical Hospital, and they are located at 1211 Medical Center Drive, TVC 9401, Nashville, Tennessee, 37232. The phone number is 615-322-4298.